This is a typical journey of a client. All right. First, they'd start feeling something in their low back or their leg. And so the first thing people do is they go to Dr. Google and look up on YouTube for some stretches, some exercises. What should we do? This can go on for days, weeks, months, depending on who the person is. Finally, if nothing resolves, they wind up going to their doctor or their primary care physician, who typically would do some x-rays, definitely give them some medications, whether it be pain medications, anti-inflammatories, or muscle relaxers, or a combination of the three, as well as a possible exercise handout with absolutely no explanation of what to watch for, what to do. If there's pain, just a handout of generic exercises. If that doesn't work, they'll change the medications up, try doing a different anti-inflammatory pain medication or muscle relaxer or some combination of, and possibly send you to physical therapy. If no change happens then it's time for the MRI. So you get the scan, which will often lead to an ortho or neurosurgeon referral because they need a specialist to take a look at you since things are not resolving in the normal time. And then they're trying to decide, is this actually coming from your back, your piriformis muscle, your hip, your SI joint? And many specialists, you'll be going back and forth between specialists as they try to determine which one is it, where's the origination of this problem. In addition to that, they'll be changing your medications, offering you injections, trying to avoid surgery as much as possible, most likely sending you back to either their specialist physical therapist or you go to your old physical therapist and get more of the same things that did not work originally. And along the journey, you may jump in and try some chiropractic treatments or massage therapy. Also throw in some yoga, Pilates, some acupuncture, some cupping, some myofascial release from Egoscue method treatments. And also you've got to throw in the miracle creams, the foam rollers, the TENS units. And throughout this time, you're throwing in a mix of what a family member or friend or coworker tells you worked or worked for somebody that they knew from the past. Add in some ER visits, possibly getting referred to pain management doctors, osteos, trying everything natural, take a shot at inversion tables or decompression treatments, try needling, everything under the sun. And for the most part, everyone here is focused on the painful side, the painful areas of the body, and did not look to other parts of the body for relief or solutions to this problem. All these treatments leave you feeling depressed, overwhelmed, confused, frustrated, fed up, worn out, angry, helpless, hopeless, and discouraged. But guess what? It is not your fault, and I completely understand. You're looking for help from anywhere you can find it. And guess what? It's not your fault. You did what you were told. You did what you felt would help you, and you felt that you were getting more than a Band-Aid approach to your issue. And I'm so sorry you've been through this mess. I understand because in 2018, my wife had a horrendous bout of sciatica. And for hours initially after the onset, which basically she woke up with pain one June morning in 2018, nothing that seemed to trigger it. She just woke up and stood up like an old lady, telling me it hurt from her butt to her heel. Asked her if I can help her. She would not let me help her, not let me touch her, not doing anything initially because all she wanted to do was catch her breath. And she prayed that the symptoms would go away as quickly as they came. She had done nothing to set this off, and she would have done anything to get relief because I know what that desperation looks like. And here she is, married to a physical therapist who is an expert in sciatica and piriformis syndrome relief, and she still was looking for anything other than help from me. It was 8 in the morning, early afternoon when she finally said, Dean, can you give me some help? I need to get comfortable. And within a week, she was out and about on her daily walks, going up to 2 to 3 miles. And I was begging with her and pleading with her to not overdo things because it is so common with clients. Once they start feeling better, they start doing things that they hadn't done in a while because they missed out on doing their walks, hanging with their girlfriends, going shopping, playing golf, doing things around the house, doing things with the ones they love because they realize when they miss out on things, they want to try to make up the time. And it's so common to flare things up. That's why it's critical to learn what your triggers are for your pain. So all this to say, I understand where you're coming from. I'm so sorry you've dealt with this convoluted mess and that you find yourself overwhelmed, feeling helpless and discouraged and hopeless and frustrated and angry and fed up, that's why I am here. I want to make things simple. I use a common sense, simple approach where I do not stress, stretch, or dig on that painful side like so many other providers do. I look for imbalances in your body, fix the imbalances first by working the sides of the body that are looser, more comfortable, and less restricted, and get you back to doing the things that you love. If this rings true, if you can relate to any of this, please, please, please feel free to reach out and let's get you started on the road to recovery.